Hi, I'm Dr. Walter Matwichuk, and I'm here to talk to you about what's known as imposter syndrome. We in REBT have a good understanding of the causes and an effective treatment for imposter syndrome. In our view, imposter syndrome effectively occurs when people conditionally accept themselves and they link their human value to their experience or level of proficiency in a particular skill. Young professionals often experience imposter syndrome, but it's not limited to young professionals. It could also continue along the course of a career. Essentially, when you're young and starting out in your career, you will certainly a lack of experience. You have your academic training, but you haven't been doing the very activity that you have been trained to do for very long. So you lack experience, and of course, you probably lack some degree of skill. Now, when you have the attitude, I absolutely have to do perfectly well, and when I'm not as experienced as I must be, or I'm not as proficient in a given skill as I must be, I'm lesser of a person. When you think this way, you will create anxiety as you attempt to do your chosen skill. And even if you do it well, you'll then have biased thinking that, well, you got lucky, or that you're going to be discovered eventually. And so these biased thoughts are what will be evidence of your having imposter syndrome. Now, the way to go about freeing yourself and eliminating the syndrome is to begin by accepting yourself and giving up your tendency to rate yourself. You can acknowledge that more seasoned experts in your field of study have greater skill and more proficiency in that skill and more experience, but you don't have to put them on a pedestal in a conditional way. Because when you put other people on a pedestal, what you're also going to be inclined to do is to down yourself, to value yourself, because you lack the very criteria that you're using to elevate other people. Whether you are an expert or you're a novice in this skill level or in your degree of experience, you remain a fallible human and an unrateable one. And so these ratings of the self are at the core of the problem. Give up the ratings of the self and you more or less will get rid of the imposter syndrome. Now, you can acknowledge with unconditional self-acceptance that yes, you're new to a given field. And then you could take practical steps to strengthen your skill, receive supervision or guidance from people who actually do the very skill that you're looking to become proficient in. So, for example, what you could do is seek out mentors who will then give you honest feedback about your implementation of all that academic training that you may have gotten and is documented by the possession of an academic degree. Sadly, there are many instances where the people that are teaching you a particular skill don't actually practice the skill they're teaching you. I know as a psychologist, this often is the case where the people teaching psychotherapy haven't done it in 30 years. They may do studies on it and act as if they then thereby know exactly how to proceed, but it's not necessarily the case that they're going to be the best teachers. And so, for example, Wendy Dryden and I have created the Academy of Rational and Emotive Behavior Therapy because we have both and continue to practice extensively. And we know that there are many psychotherapists out there who are either master's level psychotherapists who are starting their career or even doctoral level psychotherapists who are coming out of programs and need to enhance the skills that they have begun to develop while they were in their academic training. So our year-long intensive program will actually help people develop genuine confidence. Now, the other problem that you will come in contact with when you're dealing with people who are new to a given endeavor is false confidence. And actually, I think false confidence requires the same antidote, because the person who has false confidence about their skills and abilities probably are rating themselves and they're being defensive about the degree of experience they have or the proficiency they have in their skill level. So rather than acknowledging that and then facing a view of themselves as inadequate, they then falsely rate themselves as great, and they create false confidence, which could also be a problem when you begin to practice any given profession. So whether you have false confidence or you're experiencing a lack of confidence, the antidote is the same: unconditional self-acceptance. And then you can rate your level of experience or your level of proficiency. I know I've been practicing psychotherapy now for 36 years, and consequently, I believe I have genuine confidence in my ability to implement the principles and practices of REBT. It doesn't mean that I'm not a fallible human. And so what I try to do is acknowledge my level of skill, but recognize that I'm still a fallible human capable of mistakes, even if I have a great deal of experience. So to sum up, imposter syndrome is really an unfortunate thing that occurs when new practitioners, and it doesn't have to necessarily be in psychotherapy, it could be in people in the business world, in medicine. Newly minted professionals very often will experience imposter syndrome and experience shame and anxiety, and it's an ego-based problem. If you abolish the ego, the imposter syndrome goes away, and you can then, with genuine confidence, acknowledge that you're new to something and learn from people who may be more experienced at it, or even in an allied health field. My wife was a nurse, and she said that years ago, she saw much less ego defensiveness in young doctors, and they would often learn from experienced nurses. And now, at the end of her career, well, she's retired now, but at the end of her career, she saw a shift in this open-mindedness, and many, many, many young doctors would be reluctant to turn to a senior nurse, for any kind of medical guidance in a particular situation. And this is unfortunate, because nobody has mastered all the knowledge there is. And if you keep your ego out of things, you can continue to learn from people of all levels. And so we want to encourage people in REBT to abolish the ego, develop a genuine sense of unconditional self-acceptance that's authentic, rate their abilities and skills, rate those abilities and skills in an objective way. So to end today's discussion, I'd like to encourage you also, if you're unable to join me for the intensive and Dr. Dryden for the intensive training, whether you're a psychotherapist or not, you can join me on Saturdays where I do a demonstration of REBT. And that will help you to see other people learning REBT and then using it with their particular problem. And you can then learn to use it with your particular problems. It's on Zoom. It's at 9 a.m. It's every Saturday. It's free to attend. I have a great deal of fun. I've done it for over 2 consecutive weeks now, and still going strong. But I'm very happy with it, because I think it gives people an opportunity to learn REBT who may not be in a position to get REBT psychotherapy. So I encourage you to write to me at REBT Doctor, DOCTOR @gmail.com and request the link. But more importantly, I encourage you to abolish your ego so that you don't fall prey to false confidence and imposter syndrome, or fall prey to shame and anxiety as you embark on your new professional career.